Greetings, everyone. Welcome. I'm going to just give it one more minute for people to show up. I see people are popping up as I speak here, and we'll get started and get moving as quickly as possible. I think I will do a little housekeeping before I introduce our guest. Just simply, we love to see your faces if you're willing, as long as you don't have a lot of stuff going on in the background that you'd rather not, have people watching all the activity. And, ask you to mute during the presentation. And then also there is a chat function. You can ask questions right in there as we go. Also we just can speak up, ask questions, when the presentation's over. So I see the folks are popping in, so I'm just going to give it another 30 seconds here. Okay, so before I do any further housekeeping and introduce our speaker, Kate Piper, I just want to acknowledge that this is an historic day in the Twin Cities. I speak for everybody on the call, but I'm quite sure I speak for all of our staff and board of directors in saying that we are really grateful for the verdict that came down in the George Floyd case, and feel that justice was done and that we can take a deep breath and maybe move forward and start to make some progress on the issues that came out of the case, and the differences in the way African Americans are treated compared to whites. Maybe now we can really move forward and make some progress in those issues. And I just wanted to acknowledge that because it's such an important day, an important event. And I want to say that I always like to say what our next webinar is in 2 weeks. Watch out for that. It's a sort of Guardian Ad Litem 101 webinar. Many people are familiar with Guardian Ad Litem and many aren't. So this is a chance. We do, every so often, we do kind of a 101 webinar. We'll be doing one again in a little while on child welfare for those who don't, just to give an overview for those who aren't as familiar. So Kelly Leaf, who is a supervisor in Hennepin County and also the president of the court appointed special advocates nonprofit, will be doing that presentation. So with that, let me introduce our guest speaker, Kate Piper. Kate is, I'm just going to do a little bio for you, Kate, and then you fill in things that are important that I didn't. But Kate was a juvenile court lawyer for 19 years in Vermont for 2 counties and did a lot of statewide work there as well. And then she decided to go to the Heller School at Brandeis, which is a very prestigious school, and get a PhD in social policy. And did a lot of work on differential response, which she will explain to you. But in 2019, she was the chief author of a meta-survey that was published by the American Professional Society on the Abuse of Children. That covered what had been done in the previous number of years in terms of studies and evaluations of differential response. And one version of differential response, the alternative response track of that, is called family assessment in Minnesota. So many of you know this as family assessment. So in that respect, Kate literally wrote the book on what is known about family assessment or alternative response in the United States. And so she'll no doubt discuss many of her findings here. And you will also see that many of what the things that she recommends are the same as the legislative proposals that Safe Passage has been bringing forward the past several years for Minnesota. So I have a number of items that I know she will probably cover, and I can give her a reminder if there's anything that we really wanted to hear about that she didn't. But I'm just going to let you run with it, Kate, and talk about your study and what you have learned.
Okay. Hi, everyone. I I want to first tell you why I got interested in differential response. As an attorney representing kids in child abuse proceedings, I would interview the kids, and quite often the first thing they would ask me is, are my parents going to know what I tell you? And then in 2009, Vermont passed differential response, I'll call it DR, response legislation. And the way it's set up in Vermont by statute is if a case is assigned to the AR response, the assessment response, the child protection social worker is not allowed to interview the child without the parent's permission. And quite often, most often, the parents will say, well, you can interview the child, but I want to be there. And so that really upset me based on my experience with kids, and they're not wanting to know what they're telling about their maltreatment. And so I went back to school to study this. And so I've been studying DR now for 9 years. And I wrote my dissertation on this, and I wrote I was the primary author on a paper for the APSAC, the American Professional Society on the Abuse of Children. The findings pretty much echoed or confirmed what was found when Hughes and Reiches did their study of DR back 10 years before I started. I'm not sure exactly what that date is, but I would refer you all to the paper in APSAC. You can access it by going to www.centerforchildpolicy.org. And the paper is there, and there's an appendix that describes all the studies we looked at and the findings from those studies. But just to summarize, first I want to clarify the terminology. Differential response, or DR, refers to a multi-response system, multi-track system of responding to reports of child maltreatment. So usually there are at least 2 tracks: the traditional investigation track, the TR track, and the assessment response, the AR response, which in Minnesota, as Rich pointed out, is called the family assessment response. So I'll refer to DR, the AR track, and the TR track throughout this presentation. One thing that we found, I have to look at my notes, we did look at 50 different documents and 20 studies of DR in individual states and 9 multi-state studies. And what we found is there still to this day is a huge variation in the way DR is implemented from state to state, and even from county to county within the same state. And there are quite a few studies that proponents of DR point to, claiming that children on the AR track are safer or just as safe as kids on the TR track. I had my doubts about those findings, so we looked at those studies very carefully and found that there were methodological flaws and misleading conclusions in those studies. And again, those studies are summarized in the appendix to the APSAC report. But let me give you a few examples. When they're looking at child safety as an outcome, a lot of the DR proponents point to studies where they use substantiated re-reporting as a child safety outcome. And the reason this is so misleading is that cases on the AR track are not substantiated. So of course, as you increase the percentage of cases on the AR track, the percentage of substantiated re-reports is going to go down. And this study also found that, my study found that cases that were originally assigned to the AR track, when they're re-reported, they're twice as likely to be assigned to the AR track again as cases that were originally assigned to the TR track. So this makes substantiated re-reporting as a child safety outcome really problematic. So there are some cases, some studies, and mainly older studies that look at re-reporting of children on the TR track compared to children on the AR track. And they find that kids on the AR track are less likely to be re-reported. Well, one would expect this, given the fact that the high-risk cases are supposed to be assigned to the TR track, and the low-risk cases assigned to the AR tracks. So you would expect that re-reporting on the AR track would be less than that in cases assigned to the TR track. The fact that this is not true in a lot of cases is really worrisome. And the study I did found that as the percentage of cases assigned to the AR track, AR utilization exceeded 33%, there was not a single state where I found that AR re-reporting was less than TR re-reporting. So that suggests that a lot of high-risk cases are being assigned to the AR track in these DR states. It's a lot of initials. Are you guys following me? And if you have any questions, just jump in, please. I've studied this until I'm blue in the face. So yeah, the terminology may not be familiar, but so another study, another outcome that these studies point to as evidence of the effectiveness of AR is family satisfaction surveys. And usually the response rate on these surveys is really low. So it makes any conclusions drawn from these surveys really invalid and misleading. The other thing is the family satisfaction itself is a misleading conclusion because often families on the AR track are receiving material benefits, financial benefits that are not available to cases on the TR track. So of course, families are going to be more satisfied. They're getting more financial help, and undoubtedly it's badly needed, but it's needed on both tracks. The other outcome that a lot of these studies look at is service uptake. You know, cases on the AR track, the theory is that because it's a voluntary, more family-friendly track, there'll be more service uptake than on the mandatory TR track. And the problem with these studies is the services that AR families engage in are likely to be short-term and to give, you know, financial and material benefits, whereas studies have found that the cases assigned to the TR track are more likely to be offered services to address substance abuse, domestic violence, mental illness, you know, a lot of the issues that underlie chronic maltreatment. So it's an apples to oranges comparison when you're looking at service uptake. The other thing that we found is there are only 2 cases where re-reporting, just re-reporting, not substantiated re-reporting, has found that AR cases are re-reported at a lower rate than TR cases. And there are two studies in Minnesota that found this, but they found this was true only in cases that were being reported to CPS for the very first time. So these are not high-risk cases. And the other thing we looked at are the assumptions underlying DR ideology. There are 2 assumptions that proponents of DR make. And that's, the first one is that families can be sorted accurately by risk level at the time of intake by a screener or hotline person within 24 hours of the report, simply based on the information provided by the reporter. And the second assumption is that families on the voluntary, more family-friendly AR track are more likely to engage in services than on the TR track. And there's no evidence to support both of these assumptions. In fact, in study after study, the risk level of cases on the AR track, some of them are found to be alarmingly high risk. So that's why a lot of states have suspended DR or chosen not to expand it statewide. That's one reason given. The other reason is the uptake of services. Up to 50% of families assigned to the AR track are simply refusing to engage in services when they're referred. That's problematic because the services are meant to keep kids safe and to diminish the risk to kids. So as of 2018, we found that about 13 states had suspended DR, ended it, or refused to expand it statewide. And there were various reasons, as I said, the lack of engagement in services of families on the AR track, the lack of resources available to offer families, the high-risk cases ending up on the AR track, and concerns about child safety. There are highly publicized child fatalities in cases on the AR track that prompted many states to examine DR and to suspend it. And I'm sure you're all familiar with the Eric Dean case in Minnesota. In Massachusetts, 10 children on the AR track died, including 7 in 2013. In Florida, 80 children on the AR track died. Of those 80, 34 died after Florida had received at least 10 reports on the child. So these were high-risk cases that ended up on the AR track. So what's happened over time, and I think it's a good development, is that as DR systems evolve, the best practices on each track have diffused onto the other tracks. So what you're seeing is in cases on the TR track, the assessment, the broader assessment of family needs, strengths, and risks are being performed on the TR track, and a lot of the on the AR track, sorry, and a lot of the family engagement practices usually associated with the AR track are being used on the TR track. And so In several states, the only remaining difference between the two tracks is substantiation, and sometimes how the family is contacted, whether a prior notice is given, whether the child is interviewed separately without prior contact of the parents. So there really isn't that much difference between the two tracks. When APSAC wrote the paper, we didn't propose, in our recommendations, we didn't propose that you throw the baby out with the bathwater. We think it's a really good idea to treat different kinds of cases differentially, but a dual track system based on, not a lot of information at the time of track assignment is not the way to go. So what we recommended for states that want to keep their DR systems, we recommended various things. That track assignment is delayed until there is time for more fact-finding. I believe the Minnesota Governor's Task Force recommended this as well. A review of Department of Correction, court records, CPS records prior to track assignment, and often, interviews with the family, the child, and collateral contacts before track assignment. I know Wyoming, when the Wyoming Legislative Council looked at this, they recommended a delay of 1 week before track assignment occurred to give CPS social workers a chance to really do some fact finding and risk assessment. The other thing we recommended is, is that children are not interviewed with parents. I think that we don't do that with domestic abuse, domestic violence cases. I can't imagine the legislative reaction if someone proposed that the police only interview domestic violence victims if the abuser agrees or insists on being present. We don't do that with DV cases. Why are we doing that to kids? And parents have even more power over kids than abusers do over their victims in domestic violence cases. So I think that needs to be changed. The criteria for track assignment needs to be looked at more carefully. We recommend that cases not be assigned to the AR track if they have a prior CPS history, if there's evidence of substance abuse, caregiver substance abuse, domestic violence, mental illness. There needs to be a fuller picture of the family before those track assignments are made. And if they're high risk, they should not go on the AR track. And finally, I don't have a list in front of me, sorry. I forget what else we recommended, but I'll come back to it. We also looked at neglect, and neglect, there is a strong correlation, as you all know, between poverty and neglect. And I think that the differential response was in part an attempt to give low-income poor parents some resources to prevent more severe maltreatment down the road. It's a good idea, and there have been studies suggesting that actually just simply providing some more concrete resources to families is more effective than DR. So the fact of the matter is that neglect has horrible developmental consequences, and more kids die of neglect than of abuse. alone. So I'm not telling you anything you don't already know, but I think the CPS system is not designed to address child poverty, and it'll be really interesting to see how that Biden's program to lift kids out of poverty affects the child abuse and neglect rates. But as soon as the TANF block grant came in, I think states saw a 30% rise in child abuse and neglect reports. So there clearly is, a relationship between poverty and child maltreatment. But, whether CPS can fix that problem alone, I don't think so. But anyway, I want to open it up for questions. So feel free to ask me anything.
Yeah, so go ahead, please. Anybody has a question or comment, just go ahead.
I'm Lisa Hollensteiner. I was on the governor's task force with Rich and Mark, who are on. So we believe what you're saying. We recommended what you're saying, but we're getting a lot of pushback politically from DHS and some of the legislators. Do you have any insight from other states as what would help us to pass this and change things in our state? Because we just seem to be stymied.
I hear you. That must be frustrating. I think legislators need to hear the data, hear what the studies have found. And, I would ask that you please mine whatever information from the APSEC report that you can to use to change legislators' perspective on this. The DR proponents are very vocal and they're very strong in a lot of states, and they're funded by some powerful foundations, and money talks. I think you need to present some alternatives and point out that you don't need to get rid of the whole concept of differential response, but you can still have a tiered system of responding depending on risk, but you need information about risk and safety in order to respond appropriately. And that's not happening in DR systems. The dual track system is sort of artificial and not effective in sorting out high and low risk cases.
What about DHS though? I mean, they know, and they still are protesting us. Do you have any idea about that?
Well, I don't want to be too cynical, but they have an interest in increasing the number of cases on the AR track because it makes their maltreatment recurrence look reduced, because the way the Children's Bureau defines maltreatment recurrence is a substantiated re-report following a substantiated report. Now, if the case is initially assigned to the AR track and then reassigned to the AR track upon re-reporting, these kids fall off the federal radar screen. The states are not being held accountable, and the Child and Family Service reviews, and the threat of fiscal penalties goes away. And some states were really quite honest about why they adopted DR, because it makes their maltreatment recurrence data look better.
I was going to say, Kate, you said that the study that was done in Minnesota on re-reporting was questionable because it was based on survey of satisfied customers, so to speak. But if you look at the annual report from the Department of Human Services, in all but 1 year or 2 years out of the last 10, re-reports in family assessment cases, which you call AR, has actually been a percentage point or two higher every year, except 1 or 2. So it's been 15, 16% as opposed to 14, 15% for traditional response reports. So it isn't safer, and that, that's one data point on that. And I also, since I've got the floor, just want to say, Lisa, and to others, I think we've actually have made some progress this year in talking with legislators about the need to stop doing some of these things like interviewing children in front of their alleged abusers and giving advance notice that the child protection worker is coming, and some of the things that Kate mentioned. I think there's been concern, particularly in minority communities, that child protection is taking more children out of those communities disproportionately. But we, as you know, our approach is that our volunteers go visit their own constituents. So we don't just go visit every legislator. We visit legislators who are, who represent our volunteers. And, just by the law of averages, we met with, I believe it was 8 members of the Posse Caucus, which is the persons of color and indigenous, who represents all of the legislators who are not Caucasian. And we got really strong support this year from them. All but one of them were very supportive, and one of them co-authored, I guess 2 people co-authored, and several other people offered to co-author our bill. So we think next year we have a much better chance of getting traction with our bill than we have in the past. So, just to give you a little glimmer of hope.
I agree with that, Rich. You have made progress, or we have made progress this year, which is great.
Can I bring up, do you ever inquire about literacy of the parents? And the reason I bring that up is 70% of prison inmates are mostly illiterate. The police are the only ones that are aware of this, that I've talked to. Medical people, I'm a retired physician, never even thought about this. Some of the reservation people are aware of it because it's fairly common there. Do you consider parent illiteracy a risk factor?
That's a really good question. I don't know. I don't know how to answer that. I know, unfortunately, that factor is missing in most of the data, administrative data that studies base their studies on. So,
okay, you answered my question.
Okay, sorry.
So I just like to throw a question out to the group and to Kate, which is, just to summarize some of your points, Kate, you're saying alternative response or family assessment for us is not safer. It doesn't do a better job of engaging parents, which was one of the primary selling points. That 13 states, I think you said, have ended the program or, haven't expanded past the pilots. And 6 of them because of high-profile child deaths. You recommend that we have a blended family and traditional response, which is one of the main recommendations came out of the governor's task force 5. So you don't think we should interview children from the parents. You think you should do fact finding. Don't give advance notice to workers coming. All of those things are policy things. So why is one state, or why are the states that are holding on to this practice continuing to hold on to it or to advocate for it? What is in their mind? What is the rationale for continuing to do this? Because the evidence is getting to kind of be overwhelming.
It is, and usually legislators, they hear the facts, they do begin to question the Child Protection Agency. CPS likes this because, the family-friendly approach is more comfortable. Everyone wants to be supportive. That's why you go into social work. And, having those difficult, probing, intrusive interviews with families are not perceived as family-friendly, and they're off-putting. And so I think a lot of people like the AR approach, but a really skilled social worker knows how to do both, how to do the intensive fact-finding and also be supportive of families. And I think the trend is towards using those family assessment, broader family assessments on the AR track that used to be associated only with AR. Wait, I'm getting AR and TR mixed up. Anyway, there is a diffusion of practices, which is a good thing, I think. And so in a lot of states, the only difference is substantiation and the placement of the perpetrator on a central registry. Which is necessary to protect kids in the future. I understand that. But the other recommendation that Uptake makes, and I just went over it again, is our recommendation is no more than 33% of reports should be assigned to the AR track. As soon as you get up above 33%, there's evidence that high-risk cases are ending up on the AR track. And that's evidenced by the fact that re-reporting on the AR track is no longer lower than on the TR track when you assign more than about a third of responses to the AR track. So I forget what Minnesota, at one point Minnesota was up to 70% of reports being assigned to the AR track. That's way too high. And that's also something I think the governor's report found, right, Rich?
Yeah, I think it's only down to, Mark Hudson may have a more up-to-date number, but I think it's only down to 62% here. Yeah. So we're doing that. And one of the things we don't have is information on how many times children get reported before they're screened in. But we've gotten now, and Greg may have some information on that or a comment on it. Greg is a board member and a retired child protection supervisor.
Hi, Greg.
When AR first was introduced in Minnesota 20 to 25 years ago, one of the main components of it was the voluntary nature of it, that it was offered to the families. The families had a choice in if they wished to stay on that track or not. What I'm hearing more and more, and I am retired, so this is anecdotal information, not any statistical information, is that cases are now staying on the AR track even when they're being opened for case management and the parent is not in favor of it, and even when cases are being filed for CHIPS petitions with the juvenile court, which by its very nature is not voluntary. Are you seeing this slippage, if you want to use that term, in other states as well?
It's clearly happening in Vermont. There are actually as many, we call them CHINs, petitions filed in court for cases on the AR track as on the TR track. So I know DR proponents are not happy about this, but yeah, it is a problem.
And I would say, this is Mark, I think sort of towards the end of the governor's task force, it really, through the course of that process, we heard lots of different things about trying to define AR. And towards the end, there was clearly a component of saying, like, neither track is voluntary. And very much saying, well, we'll take people to court, on either track, and neither one is voluntary. And I think that, my impression of how we ended there was that during the course of those discussions with legislature and the legislators and the public and whatnot, I think that some of the proponents of the system as it was sort of understood that the idea of sort of advocating for voluntary intervention wasn't hitting very well. And people were sort of looking at that with some skeptical looks. And so it became this idea that, well, none of it's voluntary.
Yeah, and there is an interesting study by Fluke and Hollinshead and I forget who else, but they looked at the cases, the studies that were using an experimental design in Ohio, Colorado, Minnesota, maybe. I forget which ones. Anyway, check out the Holland's Head study in the appendix of our report. And what they found, they were looking at service uptake, and they found that actually the families that were the least, were not satisfied with their caseworker, were more likely to engage in services. So even people who did this study, and they're huge proponents of DR, recognize that there needs to be some, in some cases, a coercive element to get parents to engage. And certainly that's true in substance abuse cases. As one expert said, substance abuse hijacks the brain, and very often people engage in services only because of coercion from their family or from the court system, or and we're seeing more and more substance abuse cases. So the problem with the Holland's Head and Fluke study about service uptake is that the way they lump all the services together really muddles the waters. In other words, families are much more likely to accept services to help them with housing and childcare and respite and, financial and material benefits. To lump those kinds of cases in the same category of service uptake at mental health counseling or substance abuse counseling, it just muddies the waters. So take a look at that study and see what you think.
And I think part of what Mark's referring to is, you may have said this and I didn't quite catch it, but is that as part of the results of the Governor's Child Protection Task Force, now 6 years ago, the law was changed to say that cases could not be closed by the counties if parents weren't cooperative in those situations without consulting with the county attorney. So one of the ongoing issues is we have no way to know if that's actually been followed, because there is the 84 local child welfare agencies, and find out whether their practices have changed. So that's an ongoing kind of frustration. But and also, Kate, I think you referred to some of this. We were part of a study that was done. We worked with the Institute of Child Development on the study about 6 years ago on Hennepin County cases, and we found that 62% of cases at that point in family assessment were closed at the request of the parents. So it was completely voluntary, And of those that did accept services, most of them got lost on the way, either because the agencies didn't respond or because they net there were 11% of the family assessment cases actually ever got services. Now, that may have changed, because that was a while ago and we changed that practice in law. Some of that at any rate, because as Mark says, we put in the law that no child protection case is voluntary, but we don't know for sure. Mark, maybe you can say what your role is, because, and what it was on the task force as well.
Sure, I'm a child abuse pediatrician and a director of a CAC at the Children's Hospital, and I was on the governor's task force with Rich, and I was kind of chairing the component where we looked at the response pathway during that process.
And also BAPSAC, right? American.
Are you?
Same organization, I believe.
I also, what I saw in Vermont as a practicing attorney is I'd look at the history of these cases that were eventually came to court, and I was assigned to them. And over and over again, the family was reported, the family was referred to services. The family said, oh, yeah, we'll do it. And as soon as DCF went away, they dropped out. This happen again and again and again. And by the time I saw these cases, damage to the child was just overwhelming. It's one of the reasons I just stopped doing it. There has to be a change in policy. We have to really figure out which cases need the intense monitoring and the coercive element that only CPS can bring to a case. And hopefully some good safety and risk assessments will do that, begin to look at the history of these cases and really delve deeply into, look at the screened out reports as well as the screened in reports. Fortunately, when I was the kids attorney, all of that was in the DCF database. And so I could access all that information. And when you put it all together, the pattern was usually overwhelming. But a lot of attorneys don't have the time to do that. And some states don't include the screened out reports in their database. I don't know, does Minnesota?
I'm not sure what you mean by the number of screened out reports, but not the information on the screened out reports. I don't believe. Greg? Or Rick?
That's too bad. In Vermont, you got the information. You got the reporter's name and what the report was. So, you could delve into that.
Cases have been screened out, so there's enough information to figure that out.
Yeah.
But I don't know how it works. Greg or Rick would know better.
The screen out rate in Vermont is high, and that's, they say, because they count reports differently than other states. But what is the screen-in rate in Minnesota?
Well, it's a little murky right now because it went from 27% before the governor's task force up to 43%.
Okay.
And that was part of the result of the governor's task force in 2015 was to say all the counties had to follow the same standards in terms of initial maltreatment report. But in the last report we have, which is only 2019, the state says that it's still at 43%, but the federal maltreatment report says it went back down to 34. So we're trying to sort that at the moment. It's still, the national percentage is around 58, 59%. So we're well below that. If you do the math, if it goes up to 43% from 27, that means about 14,000 more children are getting some kind of child protection response, at least, a well child check, if nothing else. But we're still not screening in what a typical state would do.
Another issue that I'd like to just ask your opinion on that is not directly related, but I think has a direct impact on how this whole dual track has developed is, at least in Minnesota when they were developing it, and as then we tried to do some reframing of it, is the connection between the substantiation of maltreatment and its impact on the family in terms of subsequent reports, and especially in terms of the parent's ability to apply for certain jobs.
Oh, yeah.
And there were many of us that somewhat, well, I shouldn't say whimsically, but, an element of seriousness, but, like you're putting the differential response at the wrong side of it, meaning that you should have one approach in terms of the fact finding, the investigation, the determination of what's going on, is services needed or not, but then on the back end of it, not on the front end of it, sort out what impact this is going to have on the family's employment or on their record on a permanent basis, because not all substantiation should carry the same weight in terms of impact. Have you seen other states address that issue at all?
Yeah, Vermont has a tiered system of on their central registry. So, it depends on the severity of the risk. And I think Vermont did try to address the impact of substantiation on families. If it's not necessary to protect kids, you know, and it really has a negative impact on the whole family, you know, Vermont does not put them in the top tier of on the registry. And I forget what exactly the consequences for each tier are, but I can look into that if you like. But that's just Vermont. I don't know about other states.
Do you have, I presume that substance abuse situations have very few services available to them, or at least very inadequate. Is that correct?
In Vermont, yeah. Oh, yeah.
And therefore really don't really help the family much, of course. And that has to be a huge issue. There's very
It
little.
is, yeah. And Casey Family Services are, I forget which Casey Foundation, but they're big proponents of DR, but they did do an evaluation of Vermont's DR system at first, and they found that these cases were just being backburnered, that they were really relying too much on parental promises in their safety plans, and that there were huge waiting lists and people were on waiting lists for services. You know, so that's not going to do anyone any good.
No, right.
That is a problem, probably nationwide.
Yeah.
Yeah, so for those of you who haven't run into it, Casey Family Programs actually was kind of the developer or the inventor of differential response back in around the late 1990s. And they're a huge, they have a huge endowment. They throw off at least $100 million a year. And they invest it all in child welfare. So they are the kind of the big player in child welfare. Nobody else puts that money into the field. And they use it to basically promote their vision of child welfare, which differential response is part of. So they have a very disproportionate role in child welfare policy compared to, you know, even legislators in some respects.
And you know, and some of these studies, it was Casey that funded, that gave grants to do the studies, and also they gave them the grants to fund the concrete and material benefits available to AR families, but not available to TR families. There is another foundation called McKnight that also funded these services. And I think DR proponents actually realize that their claims of reduced maltreatment recurrence could come back to bite them, because, you know, legislators are saying, it's going down, we don't need to fund it because child maltreatment recurrence is going down. It's not going down, it's actually going up. But I think that is a problem with that definition of maltreatment recurrence. And the federal, when they reviewed revised the criteria for the Child and Family Services Review, they looked at child maltreatment recurrence. And I know that there were proposals to change that, and they didn't change it. But you know, they recognize it's a problem. So next time it's, you know, it's before the feds again, I think we need, as advocates for children, we need to have a voice in that and let them know that kids are falling off the radar screen, and we are not holding states accountable for what happens to kids assigned to the AR track.
I just want to comment along those lines, which is with kind of the family-friendly approach, it's more comfortable for everybody involved, but except the children. You know, it's all the adults involved feel like more comfortable doing that, but the kids aren't. The kids are caught in the middle. So I want to thank Robert Benson, by the way, before we lose everybody, for giving the proper link to Kate's paper, one that works. So it's in the chat box. And thank you.
Thank you.
And so I guess I have just one other thing I wanted to call out, which is you were talking about how the uptake of services isn't as great as was hoped. The uptake is there for services like financial help or with housing or whatever it might be, but not for chemical dependency and mental health. And of course, the things that really affect the children the most and are most intractable are mental health and substance abuse. And as I think a couple people pointed out, you can't really get at those issues in a voluntary system. People have to be required to get help in order to be able to, continue to parent their kids. It's just the way it works, and it has to work if we're going to be protecting children. So that's where the whole voluntary idea, and that also really applies to prevention. People are saying, well, let's just put more money into prevention, but people actually have to use those services, and the services that have the biggest impact on child abuse are the ones that people don't want. So again, there has to be some requirement in some way that people get those services if we're going to help kids.
Yeah.
Ask one more question. Do you find that we're dealing with different ethnic groups, racial groups, that the social worker working with the family does better with somebody of the same ethnic or racial group?
That's a really interesting question. I have not come across data that you could use to study that issue. I'm sure it's out there somewhere, but it seems to make sense to me.
I bring this up. A few years ago, I heard about a program called Cure Violence out of Chicago, where the city contracted with this group, which was developed by a physician infectious disease expert, who the city would call this group, Cure Violence, to go out and look for the next perpetrator and the next victim, because many of these murders patterns were clustered like an infectious disease. Dr. Gary Slutkin did this. He's an infectious disease expert. They used all Black men and women, all ex-convicts, as part of their trained team. And you can watch their YouTube videos and you're stunned by when you listen to these people, they sound more like community leaders. So I called Sandra Samuels in our Northside Achievement Zone in North Minneapolis, African-American group, to promote education of kids. And I asked her, do you think you promote new community leaders in your people that you have on your staff, which come from the community? And she says, oh, yes. And follow-up studies have shown that they reduced violence in the community in other ways, in other measurable ways in those communities. So I think that's, for me as a white physician, grew up in a small town, farming town, I don't have that knowledge and experience of people, say, in an urban, tough district and the racial issues. I don't have that knowledge. I do have experiences that are different from others, but and that does make a difference. But I wish that was more of an issue. In other words, when you're hiring staff, social worker staff or treatment staff, using that, because I think it potentially has an opportunity. Cure Violence to me is the model.
I know in Vermont, we try to have peer advocates recruit some parents who had been through the system and benefited from the services and actually completed them. And we had no luck, probably because of time commitment. And, and there are class issues that come into play in Vermont. Not a lot of racial issues because this is such a white state, but I think we see the same thing with class issues.
Well, I think we have kind of basically gone for the full hour, and I appreciate everybody's participation and good questions. And thank you, Kate, for this. I'm sure that we will be working with you some more on some of these issues as time goes on. You've been a great partner for us, and we appreciate that as well. So again, 2 weeks from now is guardian ad litem kind of presentation on how that works for those who have not been familiar. And we hope to see you all then. And thanks again, Kate. I won't click off until everyone else does in case anyone has a question. But thanks, Kate. Feel free, everybody, to end your call, and we'll see you next time.